Today we're going to discuss suicide. You wouldn't typically think of this as a middle school topic, perhaps more of a high school topic, but as you will soon come to understand, like many issues in today's society, the effects on the younger population are becoming more prevalent. At the conclusion of this activity, you should be able to define the scope of youth suicide using national and statewide statistics, discuss New Jersey statutes pertaining to suicide and their relevance in the school setting, list at least 4 risk factors that contribute to youth suicide, identify at least 3 warning signs for suicide, name at least 2 triggering events that may lead to suicide, state at least 3 ways that youth may be impacted by suicide in the media, describe at least 3 prevention programs and strategies that can be used to assist a vulnerable student, discuss the purpose and functions of the crisis response team, describe the staff member's role in the identification and referral of a suicidal student, and finally list 2 protective factors that can reduce the risk of suicidal behavior. So let's talk about some national statistics about suicide. Suicide is the second leading cause of death in the U.S. among youths aged 10 to 24. In ages 10 to 14, we have seen an alarming increase of more than 150% in suicide since 1981, making it the third leading cause of death for that age group. More teenagers and young adults die from suicide than from cancer, heart disease, AIDS, birth defects, stroke, pneumonia, influenza, and chronic lung disease combined. 4 out of 5 teens who attempt suicide have given clear warning signs. And more than 90% of people who die by suicide have a diagnosable mental disorder. These numbers keep rising. We must do everything in our power to turn these numbers around and let the kids know they have better options and there is someone out there to help. Now we move on to statistics specific to New Jersey. Suicide is the third leading cause of death for New Jersey's youth ages 10 to 24. The 3-year average rate of suicide among Black non-Hispanic youth is at 5.2, which is almost equal to that of white non-Hispanic youth at 5.4. The rate for Hispanic youth is much lower at 3.4, and the Asian Pacific Islander rate is higher at 5.9. Lastly, we have some important suicide rates by county. Mercer, Warren, and Ocean have the highest rates of suicide attempts. Bergen County has the highest number of completions with 26, and Salem County has the lowest number of completions at 4. Now, this is the most up-to-date data from the New Jersey Department of Children and Families Youth Suicide Report for 2016. The data in this report focuses on the past 3 years, 2013 through 2015. Now, this graph shows us the relationship between the national rate of deaths by suicide in 10 to 24-year-olds compared to the state of New Jersey's rate. As you can see, our rate has remained below the national rate, but it has been climbing over the past 15 years. In this slide, they have divided the state into regions. The darker the red, the higher the rate. The lightest section at the top right of the state, called the Gateway region, has a rate of 4.3. This rate includes the county with the highest rate of completions, which is Bergen. The next region, the lightest red area at the bottom left of the state, called the Delaware region, has a rate of 5.1, and that includes Salem County, the one with the lowest rate of suicide completions. The next region, the medium red area at the bottom right of the state, called the Shore region, has a rate of 6.1. This area includes much of the Jersey shoreline and casinos in Atlantic City. The region with the highest rate of suicide, called the Skyland region, is the dark red area at the top left of the state, and this region has a rate of 7.5. This slide is interesting because the regions with the highest rates may not be the ones you would have expected to have the highest rates. There are some New Jersey statutes that are especially relevant to the school setting that you should be aware of. NJSA 18A 6-111 is findings and declarations relative to instruction in suicide prevention in public schools. This law explains that a person who is considering suicide may exhibit behavioral warning signs. If someone notices the warning signs of suicide, it may be possible to avert a tragedy. With the exception, possibly, of a parent, no one is better situated than a teacher to detect these signs and to initiate appropriate steps to prevent a suicide attempt. Proper training for teaching staff members can thus save pupils' lives and save the families and friends of would-be victims the trauma of a suicide or suicide attempt. Moreover, early identification of depression and other problems may help to reduce the number of young people who commit or attempt to commit suicide once they have left school and entered adulthood. This statute requires instruction in suicide prevention as part of any continuing education which public school teaching staff members must complete in order to maintain their certification. The requirement is for 2 hours of suicide prevention instruction every 5 years, provided by a licensed healthcare professional with training and experience in mental health issues. Next, we have NJSA 18A 6-113, and this one is provision for instruction in suicide prevention in school curriculum. It's a statute that required the State Board of Education to revise core curriculum content standards in health and phys ed to provide for instruction in suicide prevention in an appropriate place in the curriculum of elementary school, middle school, and high school pupils. So it basically ensured that suicide prevention became a component of health education in schools. And this statute was enacted in 2013. Next, we have NJSA 39A-13, Youth Suicide Prevention Program, is a statute that ensured the adoption of a statewide youth suicide prevention plan. The program is implemented by the Department of Children and Families, also known as DCF, and DCF continues to expand and strengthen the program in New Jersey. During the development of this initiative, it was found that New Jersey needed a greater capacity to handle suicide hotline calls. And so in 2013, the New Jersey Hope Line was launched, and we will discuss some preventative programs in New Jersey and nationally in greater detail a little bit later in the presentation. Lastly, we have NJSA 39A-24, and this one is report by a teacher of attempted completed suicide by a student, other reporting requirements. So this is a statute that was just recently updated in a broadcast that the New Jersey Department of Education sent out to school administrators on June 27th of 2017. And it requires that any teaching staff member who, as a result of information obtained in the course of the person's employment, has reasonable cause to suspect or believe that a student has attempted or completed suicide must promptly report the information directly to the Department of Children and Families via an online form. Other reporting requirements are also outlined in this statute. So risk factors are personal traits or environmental qualities that are associated with suicide. And the first step in preventing suicide is understanding the risk factors for your population, which is, in this case, middle school students. We are going to divide these risk factors into 3 categories, which are personal variables, family variables, and environmental variables. Starting with personal variables that contribute to suicide, which are previous attempts. Those who have attempted suicide before are 8 times more likely to do it again. History of mental disorders, especially depression. 60% of those who commit suicide suffer from depression. Many people may mistake the signs of depression in teens as the moodiness of puberty or teenage drama. Depressed teens may sulk, act out, get in trouble at school, express negativity, and feel misunderstood by others. And this depression may lead to attempts at self-harm. Feelings of hopelessness, like things will never be better. Impulsive or aggressive tendencies. Research has shown that there is a connection between interpersonal violence and suicide. Feelings of isolation. These teens may perceive their teachers don't care or understand them, and they may have poor connections to peers. Poor self-esteem or body image. The child's perception of self as overweight, which can occur in both boys and girls, or underweight, which is often boys, can be directly linked to depression and suicide. Children are constantly told and shown through TV, magazines, etc., that their ideal body images are slender females and muscular males. Substance abuse, alcohol, and drug use clouds judgment, lowers inhibitions, and worsens depression. Drugs and alcohol are associated with 50 to 67% of suicides. A recent loss, death of a family member, a friend, or a beloved pet. Trouble with the law or authority. Students who are LGBTQ. These students are 3.3 times more likely to have suicidal ideation and 3 times more likely to attempt suicide. And interestingly, when you break down this group into more separate categories, the lesbian gay youth were 3.8 times more likely to attempt suicide, and bisexual youth were 6 times more likely to attempt suicide when compared to heterosexual youth. The reasons why the numbers may be so much higher in the bisexual group of kids is that they may suffer a double discrimination from both heterosexual and lesbian gay peers, leading to increased feelings of isolation and depression. Peer rejection or bullying. Also being the perpetrator of bullying, these two kind of go together. There have been several cases in the media of bullying or cyberbullying where the kids were harassed and mistreated so much that they chose to take their own life. Cyberbullying has taken bullying to a whole new level. Kids don't just have to have fear going to school thanks to the internet. Online bullying can occur 24/7. Messages are permanently displayed, and it's harder to find the offender and impose a penalty. Some of the statistics are surprising. Boys who were bullied suffered from suicidal ideation 2.5 times more than those who were not bullied. Girls, 4.2 times more than non-bullied girls. Boys who bullied others, 3.8 times more than other kids. And girls who bullied others, 8 times more than other kids. Self-injurious behavior or self-mutilation. These behaviors include headbanging, cutting, burning, biting, erasing, and digging. Appropriate response to this behavior is crucial. These are not suicide attempts, but can potentially lead to suicide. Talk to the guidance counselor if you see or suspect the student is harming him or herself about what to do and how to react. Perfectionist or loner personality. The perfectionist may not know how to cope when things don't go the way they had anticipated, and the loner practices isolating themselves so much that they may have no support when difficult events occur. Abused, molested, or neglected students have been through a traumatic situation. The pain, isolation, lack of support, and lack of a caring environment can lead to feelings of hopelessness, poor self-image, and wanting to escape by any means. There are also family variables that increase the risk of suicide in middle school kids. A family history of suicide, family violence, physical or sexual abuse, and it doesn't have to be occurring to the child. It could be a sibling or a parent that is the focus of the abuse, and the child sees the abuse every day. Parental psychopathology, or simply mental illness. One or both parents with mental health disorders will increase the risk of suicide in their children, either through the child inheriting the disorder or how they are affected by their parents' mental illness. Certainly parental divorce, family history of substance abuse. And lastly, there are environmental variables that affect the risk of suicide. The access to fatal methods. Are there guns or weapons in the home, or access to medications perhaps? Barriers to treatment. The stigma associated with mental health disorders may prevent kids from seeking the appropriate professional help. And local epidemics, like recent suicide of a family member, peers, or celebrities. This is sometimes called the copycat phenomenon, and we're going to talk about that again in a moment. There are many warning signs for suicide, and you will notice that some are similar to the risk factors we just discussed in the last slide. These warning signs include making suicidal threats or comments like "I want to die," seeking access to means like pills or weapons or something else, preoccupation with death, dying, or suicide. You will notice it in the way the student talks through their writing and sometimes drawings in art class or doodling in their notebook. Changes in sleep and appetite. A student that normally came into class well rested and focused is now falling asleep during your lecture, or a student that used to eat a good lunch in the cafeteria is not even getting a tray, or just picking at the food but not really eating, or a student that begins to complain of frequent stomach aches. Dramatic mood changes. This is something that may just be shrugged off as moody or hormonal teenage attitude, but if this is something new in their behavior, it could be a warning sign that something is truly wrong. Acting out, violent behaviors, a general sense of feeling helpless, hopeless, or worthless. You will notice this change in outgoing kids more easily than the shy ones. Use of alcohol and drugs. This one, if you see it in school, it carries a whole other group of concerns, but you may hear students talking about it. Acting anxious or agitated, talking about being a burden to others, saying things like, my family would be better off if they didn't have to deal with me. Increased risky or self-destructive behavior. Inability to concentrate on routine activities, changes in classroom behavior, and poor grades. These would obviously be noticed by teachers and support staff. For example, one of your students that always cared about, say, turning in assignments completed and on time suddenly becomes increasingly late and sloppy with work. Certainly changes in physical habits and appearance, either negative or positive. A lot of times a student will go from a well-kept appearance to having poor hygiene and looking sloppy, but this isn't always the case. He or she may try one last-ditch effort to look like or fit in with the other kids by wearing the same clothes or hairstyle. Sudden changes in personality and friends, like when a typically model student starts backtalking and disrupting the class during lectures and begins hanging out with a different crowd or just suddenly becomes more rebellious. This could be a warning sign. Giving away personal belongings or valuables, and also saying goodbye to friends. This is very important. If you hear this in your classrooms, notify someone, like the school counselor, immediately. This student probably already has a plan in place. Triggering events. Triggering or precipitating event is a recent life event that serves to trigger moving an individual from thinking about suicide to attempting to take his or her own life. These can often be confused as the cause of suicide, but just know that no single event will cause suicide. Typically, several risk factors are present. Some of these are risk factors too, so you may see some items repeated. Breakups or relationship issues, family problems, feeling like they don't belong, sexual, physical, or mental abuse, drug or alcohol addiction, mental illness, trouble with authority, legal issues, the death of a loved one, problems in school, repeated bullying or cyberbullying. Again, continued harassment, picking, and taunting can isolate and prompt the student to become suicidal. Any problem that the student feels is hopeless can trigger an attempt at suicide. If they feel there's no way out, no relief or end to whatever is bothering them, the student may resort to suicide to escape the situation. Basically, all of these things are going to increase feelings of isolation and depression. Suicide in the media. Children today have frequent exposure to the media, and unfortunately, there has been quite a bit of recent media coverage relating to suicide. The way in which we discuss, depict, and report on suicide as a society is extremely important. Sadly, sensationalizing or glamorizing suicide in the media can contribute to an individual's suicide risk and can even create contagion, especially among teens. A number of well-known people have committed suicide, including Kurt Cobain in 1994, Robin Williams in 2014, and most recently Chris Cornell in May of 2017, and Chester Bennington, also this year in July, who were both well known for being in successful bands. Bennington was said to be very upset about his friend's suicide and killed himself on what would have been Cornell's 53rd birthday. Youth who follow these celebrities may be especially affected by their suicides, and a vulnerable child who is already struggling with suicidal thoughts and is exposed to news stories of celebrities committing suicide may sadly be more inclined to think that suicide is an acceptable option. The impact of what can be perceived by kids as one musician killing himself in honor of another musician truly has the potential of causing a suicide contagion. The internet and social media. There is increasing evidence that the internet and social media can influence suicide-related behavior. Unfortunately, an immense quantity of information on the topic of suicide is available on the internet and via social media, and children now have access to it at their fingertips. They can find information about suicide methods with a quick Google search. They can also easily find chat rooms, message boards, and other forums that are pro-suicide and may influence their decision-making. Suicide and self-harm videos are available on the internet and can normalize self-injurious behaviors among young people. The internet can contribute to suicidal behavior when it involves cyberbullying and cyber harassment as well. One study found that middle school victims of cyberbullying were almost twice as likely to attempt suicide than those who were not. It's important to reiterate that internet sites and social networking sites for suicide prevention do exist and can increase awareness and provide support. And then there are things out there on social media like in the next slide that take suicide to an entirely different level. The Blue Whale Challenge is a dangerous online game that manipulates vulnerable young people into completing a series of 50 tasks from administrators of the game. The tasks begin fairly simply and escalate to dares that involve self-harm, the last of which is to die by suicide. The game is thought to have originated in Russia and has supposedly incited young people worldwide to commit suicide. Instagram and Snapchat are the most common sites used for this challenge. The power of pop culture. 13 Reasons Why is a popular television series based on a novel by Jay Asher about a 17-year-old girl who commits suicide and leaves behind 13 audio tapes explaining what and who led her to do it. It has been widely watched by teenagers. Teens have tweeted more about this show than any other program this year. The series includes some very graphic content, and there has been some concern that the series glamorizes suicide. Vulnerable youth who already have some degree of suicidal ideation may view the series as presenting suicide as an acceptable option. On the flip side, the series has generated a lot of good dialogue amongst teens, their parents, and school staff, as it has shown a spotlight on bullying and made some teens realize how their bad behavior can affect their peers. We have talked a bit about negative influences that our middle schoolers may be subjected to. Let's talk now about prevention. There are over 1,700 suicide and emotional helplines worldwide and on the internet to deal with the warning signs of suicide. Most prevention models emphasize knowing the risk factors, educating teachers to recognize warning signs, and major collaboration between school, community, and family in educating the children. Here are some examples. The National Suicide Prevention Lifeline is a national network of local crisis centers that provides free and confidential emotional support to people in suicidal crisis or emotional distress 24 hours a day, 7 days a week. They are committed to improving crisis services and advancing suicide prevention by empowering individuals, advancing professional best practices, and building awareness. It was launched January 1st, 2005, and the number is 1-800-273-TALK. SOS Suicide Prevention Program is the only school-based prevention program that addresses suicide risk and depression while also reducing suicide attempts. There is solid evidence to show that the SOS program works. It is currently used in thousands of middle and high schools in all 50 states. It gives young people a depression checkup, the knowledge to recognize depression in themselves and others, and to respond effectively. The program highlights the relationship between suicide and depression, teaching that most often suicide is a permanent response to a temporary problem. The kit includes the Signs of Suicide Middle School Program Implementation Guide and resources, DVDs, and discussion guides. The middle school program is called Time to Act for students, and Training Trusted Adults is for school staff, parents, guardians, and community members. Also included are screening forms and materials that you can use to communicate with staff, parents, and students, like newsletters, guidelines, and stickers. This program discusses how to build a team, how to get administrative buy-in, planning staff education, student implementation, and a follow-up plan. It is a very comprehensive program. The crisis response team is a group of well-trained staff members at a school that come together during a number of different crisis situations in the school setting. We are going to discuss this program in particular in much more detail coming up in a few minutes. Now I want to talk about some resources that are specific to New Jersey schools. The New Jersey Hope Line, established May 1st, 2013, is a dedicated in-state peer support and suicide prevention hotline staffed by mental health professionals and peer support specialists 24/7. The service is available to callers of all ages for confidential telephone support, assessment, and referral. They are members of the National Suicide Prevention Lifeline. The number is 1-855-New Jersey Hope Line. Traumatic Loss Coalition for Youth, also known as TLC. Their mission is suicide prevention and trauma response assistance to schools following suicide or homicide and deaths that result from accidents and or illnesses. Functioning as an interactive statewide network, TLC offers collaboration opportunities and support to professionals working with school-age youth via education, training, consultation, and coalition building to reduce suicide attempts, suicide completions, and to promote recovery of persons affected by suicide, and to promote and provide guidance and support in responding to a traumatic event. Second Floor Youth Helpline is accredited by the American Association of Suicidology. This program confidentially serves youth and young adults ages 10 to 24. Youth who call are assisted with their daily life challenges by professional staff and trained volunteers. They have links to information about dating, cyberbullying, eating disorders, LGBTQI, sex, substance abuse, and mental health. Their number is 1-888-222-2228. Perform Care Mobile Response is a full-service behavioral health managed care company supporting members in the public sector. Founded by service providers in 1994, Perform Care is a member of AmeriHealth Caritas and is dedicated to ensuring the delivery of quality health care to low-income populations covered by publicly funded programs. They help people get care, stay well, and build healthy communities. And lastly, we have World Suicide Prevention Day, which is September 10th. Prevention strategies. Schools are in a unique position to promote healthy development and provide protective buffers for students, offer risk prevention programs, and help to identify and guide students in need of special assistance. Reducing stigmatization of mental health, enhancing peer support, reducing psychosocial difficulties within the classroom, promoting learning, resiliency, and healthy development in all youth, helping them to learn how to cope when the bad things happen, like a death in the family, a bad grade, or losing the game. And these last two kind of go together. Reaching a broad group of students with varying levels of mental illness and reducing difficulties in recruiting and screening limited segments of the student population by identifying and getting treatment for students in need through screening and informing the school counselor of concerns, we can help to prevent suicidal ideation from escalating to an attempt or a completion. The crisis response team. Development of the crisis response team is one required part of the school safety and security plan. The crisis response team is assembled and trained to be readily available in a number of crisis situations in the school setting, such as suicide, violence, accidents, or natural disasters. Rather than go into great detail about the many possible scenarios, this presentation will simply give an example of how the school crisis response team in your school might respond to suspected suicidal behavior, attempted suicide, or completed suicide. First of all, the main purpose of the CRT is to be proactive rather than reactive during a crisis. The team is going to ensure that they are prepared to appropriately and adequately identify and respond to a crisis situation that may potentially affect the functioning of the school, students, staff, or community. If the team is well trained and prepared, the crisis is going to go much more smoothly and decrease the short and long-term aftermath of a suicide in the school setting. Crisis response team members. The different team members and their collaborative roles will vary depending on your district and its unique needs. One example of a CRT may include these key members. First, the principal, administrator. He or she will be the coordinator of the whole process. And this person's also responsible for contacting the parents, administration, and the media. Certainly the counselor, the guidance counselor, is trained in conducting the risk assessment and will refer as necessary. The counselor may also conduct regular counseling sessions with an affected student. The school psychologist, also trained in these assessments and is an integral part of the team. Social worker, usually in close contact with community resources and the family during the process, and they may act as the community liaison. Security is going to be in charge of securing the building and ensuring the students are safe during a crisis. The school nurse, typically in charge of any first aid during a crisis and may also be trained to conduct risk assessments. The nurse may also be the medical liaison. And other trained staff members. Other staff members may be assigned minor roles, such as being an escort or ensuring documentation is completed. Even if you are not a member of the CRT, it is vital that you make yourself aware of how to respond to a crisis in your school. So we're going to talk briefly about identification and referral. We already talked about the possible signs or risk factors you may see in a student that may be suicidal. Just knowing them is not enough. You also need to know how to respond. Remember, suicide is preventable. There are almost always signs, and students are often looking for help, and you can make a huge difference here. You need to ensure that if you have any suspicion of suicidal behaviors, you respond right away. Do not leave the child alone for any reason. Give them privacy by not calling them out in front of the other students. You might wait until the end of that period if the child is not in immediate danger. Never send them without an escort, even to the bathroom. You can report your suspicions to any member of the team if necessary, and they can handle things from there. However, your best option would be to report it directly to your principal. The principal will act as the coordinator of the process and will know how to quickly contact all the necessary members of the team. Having a general knowledge of the possible interventions will be greatly beneficial to you. You may use this information to prepare your students and gain their trust. Telling them what to expect during their risk assessment may help alleviate some anxiety. Crisis response team intervention. Any one of you could be responsible for the initial detection of an at-risk student. Don't be afraid to ask questions, listen carefully, and refer when needed. The actual intervention is going to depend on the risk level of the student. It is up to the CRT to conduct a risk assessment and determine the severity of the situation. Once the risk assessment has been completed, the CRT will notify the parent and either have the child sent directly to the crisis center or ER via ambulance, or by the parent in less serious situations. Administration will also be notified. The CRT should be aware of the many community resources in their area. These resources are going to be used throughout the process. Documenting the entire process is also required. Assuming everyone did their part and there was a positive outcome, follow-up and re-entry into school is the next step. Our guidance counselor and social worker will maintain an open communication with the family. Any necessary counseling will be scheduled, and transition back to school may be a slow one that might start with home instruction. Staff will be kept in the loop and are encouraged to ask questions. Other students may also have questions. It is recommended to keep your answers brief but factual. We all play a big part in dispelling rumors. Risk assessments. There are many different suicide risk assessment tools that may be used. This assessment is typically conducted by the guidance counselor, the school psychologist, or the school nurse, depending on which trained individual is available during the crisis. These are some examples. As a general rule, these tools usually consist of similar questions. Very direct questions will be asked, such as, it is not uncommon for kids your age that feel overwhelmed or stressed to consider suicide. Is that something you are considering? Intent and means are also going to be determined by asking if they have a plan and the means to do it. And some tools have a junior version for younger age groups. We'll talk a little bit about postvention. Once a completed suicide has been confirmed, the CRT will focus on the postvention. Notifying the immediate community is an important step in avoiding hysteria and rumors. With any death in the school community, there are going to be many grief-stricken people, including staff, students, immediate and extended family, the entire community. This is an important time to stick together, and your administrators may even have more frequent staff meetings to keep everyone updated and give everyone a chance to talk and ask questions. Trying to avoid and being on the lookout for suicide contagion is very important. Those close to the victim and those exhibiting other common risk factors should be closely monitored. A member of the CRT will be responsible for contacting the media and the community. The purpose of this is to dispel any myths circulating and replace them with facts. Media, especially social media, as we spoke about earlier, is well known for romanticizing suicide. Memorials should be limited, as they tend to also romanticize suicide, and they tend to focus on the wrong things. We should rather help encourage these efforts to be put to better use, such as starting support groups or even starting a fundraiser for mental health organizations. Talking about mental health in an open, positive forum is a great thing, and it helps to lessen the stigmas attached to mental health disorders. Protective factors are the things that can reduce the risk of suicidal behavior, things to try to encourage your student to become involved in and be a type of support system to them. Good family relationships and support. A strong support system will help them through tough times in life and give the child a sense of the right path. Strong problem-solving skills. Physical activity or participation in sports. Access to mental health care. Those students diagnosed with a mental health issue will function optimally with the appropriate treatment and counseling to control symptoms. Social interaction through clubs, activities, religious organizations like Boy Scouts of America, their church, synagogue, mosque, temple, or other religious affiliation, police athletic league, boys and girls clubs, 4-H program, Girl Scouts, Jewish community centers, and of course, positive relationships with teachers and other adults. Please feel free to ask any questions you might have. And we have a list of the many references we used to compile this PowerPoint presentation.